We're live in studio with Dr. Deepa Chintala and Dr. Yamuna Gurrapu discussing primary care and preventative health. The number to the studio is 972-235-5555 to be a part of the conversation. Dr. Gurrapu, if diabetes runs in the family, how does somebody know if they're at risk for it? What are some of the signs, and how can they get tested for that?
Thank you, Dr. Prakash. So diabetes is more prevalent, like 15.8 to 12.9% in US. There are two types of diabetes, type 1 and type 2. Type 1 is mainly like a genetic and familial. I mean, if they have a history, family history like that, it's better to start the screening as early as possible. If type 2 is mainly risk, like a diet, lifestyle, obesity, all these things. So if you have a family history and having the risk factors, it's really important to get checked up as early as possible to screen the diabetes, annually or every 2 years if it's normal initially. But always it's better to start early screening.
Great. We had one caller over the break ask if diabetes can be treated with diet and exercise.
This is Dr. Chintala. Thank you for the question. Yes, diabetes can be avoided and it can be controlled better with exercise, but not completely treated. Once if you're a full-blown diabetic, you need to be on medication. But if you continue doing exercise, lose weight, stick to a very good diet, there is a chance that you can come off the medication and be monitored closely.
Let's take a live call. Hey, you're on Doc Talk. What's your question?
Thank you for the question. This is Dr. Gurrapu. So basically what I understood is that you had a scratch, and if it's not healing quickly, definitely that has to be a sign of different issues. It could be anything, it could be infection or it could be underlying metabolic issues. So I would definitely recommend, see your primary care doctor and be evaluated that scratch.
Let's take a call. Welcome to Doc Talk. What's your question for our experts today? Great question. Dr. Chintala?
Thank you for the question. When you are a diabetic, we recommend that you have a yearly eye exam done by an ophthalmologist, which they will check the retina for any changes, so that if there are any problems, they can act on it and avoid vision loss.
Excellent. Folks who are joining us, you're live in the studio. We have Dr. Chintala and Dr. Gurrapu talking about preventative health as well as primary care. Number 2 studio is 972-235-5555. Dr. Chintala, does alcohol really increase your risk for cancer? And should you avoid it if there is a family history of cancer? And what are the long-term effects of this on the body?
Yes, thank you for the question, Dr. Makadia. Alcohol itself, when it is broken down, it can cause a lot of carcinogens which can modify your DNA, and that puts you at increased risk for cancers along with your head and neck, the esophageal cancer, which is the food pipe, and also the liver cancer. And in women, if you drink alcohol, your risk for breast cancer is increased by 15 to 20%. And as you know, alcohol does damage your liver. Depending on how much you drink in a day in women to 2 drinks in a man, you're considered to be an alcoholic, and that puts you at increased risk for liver disease, and the liver cirrhosis long-term can lead to liver cancer.
Let's take some more calls. Welcome to Doc Talk. What's your question? Hello? Let's try another one. Hi, you're on the air. What's your question? ahead, Dr. Gurrapu.
Thank you for the question. So basically, I am not sure when was your diabetic got screened. I mean, if you are a pre-diabetic or borderline diabetic, I would recommend annual checking A1C, hemoglobin A1C. And if you are having other skin changes, I would definitely rule out the other hormonal problems like a hypothyroidism, things like that. So please check with your doctor and see any other options for the changes.
Let's take a call. We're getting a lot of phone calls. If we didn't get to you, keep calling back. The number to the studio is 972-235-5555. Dr. Gurrapu, what is one critical step that you can take in each decade of your life? Say preventative in your 20s, in your 30s, your 40s, and so on.
Thank you, Dr. Prakash. So we start screening, a routine like high blood pressure, obesity, physical activity, starting from 20 years. And if their BMI is more than 25, we have to definitely screen for diabetes. Once we reach 30, for the women, we'll definitely do the pap smear and prostate cancer screening at the age of 40. And 50 years, we'll screen for colon cancer.
Let's take some more live calls. Hey, you're on the air. What's your question?
Thank you for the question. This is Dr. Chintala. Usually the sugar levels can be elevated in the body depending on the diet you had the previous day or the stress levels. So we don't diagnose you with the diabetic with a single high sugar level. We need at least 2 to 3 readings to diagnose you, but nowadays the diagnosis of diabetes goes more towards the HbA1c, which is gives us the average picture of your blood sugars for the last 3 months. If that is above 6.2, 6.3, we start treating you as diabetic. If it is between 5.7 and 6.2, we call you a pre-diabetic, and we recommend that you have a strict diet and exercise and have these levels repeated in 3 months to see which way you're going.
Let's take some more calls. You're on the air. What is your question?
Sure. Thank you so much for the call. Maybe this is a good time to discuss what are the criteria for one to be diagnosed with diabetes.
Yes, thank you for the question. This is Dr. Chintala. Once again, the blood sugar, the fasting blood sugar has to be above 125 at least for 2 readings for you to be diagnosed with diabetes. And as I said, nowadays we are going more towards the HbA1c, which gives us the accurate 3-month average blood sugar levels. So if you're below 5.7 in the HbA1c, you're fine. If you're between 5.7 and 6.2, you're called as a pre-diabetic. Anything above 6.2 or 6.3, you're called a diabetic, and you need to be started on medication.
I think the key there is that the A1C level has to be checked by your primary doctor. Don't be fooled by your fasting blood sugar in the morning being in the normal range and thinking you don't have diabetes. Let's take another call. Hey, welcome to Doc Talk. What's your question?
I have a question. I have been pre-diabetic and then now I'm diabetic. My doctor gave me metformin, and this metformin I'm taking it, but I don't know what it is. When I actually go to the bathroom,
Dr. Gurrapu?
Thank you for the question. This is Dr. Gurrapu. So, if your physician is giving you the metformin and that is giving you a lot of problems like diarrhea and stool issues, you have to discuss with the physician and see maybe she can change it to different one which you can tolerate better. But if the physician is thinking that you should be on medication, yeah, definitely that is something you have to discuss with her. But there are a lot of other options. Metformin typically does a lot of GI problems like diarrhea, stomach cramping and pain, things like that.
Let's take some more live calls. Hey, you're on the air at Doc Talk Live. What's your question?
Thank you for the question. This is Dr. Chintala. All these guidelines that are based for the screening tests are based on evidence-based medicine. That means the studies have been done and all these guidelines have been brought up so that this will give us a guidance for the physicians to screen the patients at regular intervals. So all these have been proven to help you in diagnosing cancer earlier, and so that the treatment will be easier and less side effects.
Great. Let's take another call. Hey, you're on the air with Doc Talk. What's your question? Okay, good question. Dr. Gurrapu?
So what I understood is the arthritis and the diabetes predisposition. Like, okay, so basically the the diabetes can trigger the other issues, other comorbid conditions. Let's say if you're obese and you can be a diabetic and you can have arthritis problems together. So treating both, you have to maintain your weight, at the same time you have to control your diabetes. That will help with your arthritis.
Being a diabetic can also lead to neuropathy, which you can manifest, think about it as arthritis, but it is actually damage to the nerves. And diabetes can affect every single cell in your body, right from your brain to your toe. So this has to be controlled, and your HbA1c being at 5.9 and 5.8 is a really good control, so you're doing a great job in maintaining your blood sugars.
Getting close to the end of our show. Let's take one more call. Hey, you're on the air. What's your question?
Hi, my husband is 48 years old, and he has no family history of diabetes, but we recently got his checked, and the A1C says his levels are 8.3. So do you think he has to take medication for diabetes?
That is a good question. This is Dr. Chintala. Even though there is no family history, given a diet and lifestyle, you always have a risk of developing diabetes. So with the HbA1c of 8.3, you surely need, your husband has to be on medication, and the levels have to be monitored by his primary care physician.
Folks, we're reaching to the end of the show. Any last minute information for our callers? We have about 10 seconds.
Yes, this is Dr. Chintala. Preventative care is very important to maintain a good, healthy lifestyle. So please follow up with your primary care physicians.
See you guys next week. Stay healthy. We're cutting it.